Have you ever wondered if there are new approaches to dealing with PTSD? Well, right now there are studies that are on the go with MAPS, the Multidisciplinary Association for Psychedelic Studies, which is undertaking clinical research on psychedelics. These are substances like MDMA, ayahuasca, and other substances. Right now I have Tyler Hooper, who is an author of an article that came out in Esprit de Corps that looks at MDMA and the research they're finding in clinical trials that they're getting very good outcomes. So I'm so happy to speak with you, Tyler, about this new research and what it means to military members and those people particularly who've experienced PTSD. So thank you for speaking with me.
Well, thank you for having me. I really appreciate it.
So I understand that you've done a bit of research on this MDMA assisted psychotherapy, and that it's not, MDMA itself is not psychotherapy, but when people use MDMA, they combine it with psychotherapy because it makes them more at ease, more comfortable with exposing the trauma stories. And there's some very good reasons for that in terms of what MDMA does with brain chemistry. So maybe you can start by talking a little bit about that.
Sure. Yeah. So everything you said is absolutely correct, and I think for veterans especially, the MDMA helps people who maybe have a hard time talking about their emotions and their feelings and the trauma that they've witnessed. The MDMA, as you said, it kind of opens up parts of the brain that allow you to discuss what happened to you in an easier way and in an open setting. So parts of the brain like the prefrontal cortex, the amygdala, and the hippocampus, those are parts of the brain that are susceptible to the drug MDMA and help these people open up about the trauma they've experienced. And the psychotherapy, as you said, is the main focus. The drug itself is only helping the patient relive what they experienced and tapping into their emotions so that they can talk about it.
So what kind of findings are they seeing with this MDMA? I understand the timeline is very short. Can you explain how that works?
Certainly, yeah. When you say timeline, do you mean the timeline of the sessions or the...
Well, I understand that they take the MDMA only a few times and they have more intensive therapy, so the whole treatment modality lasts a very short time. Can you just talk about how it's structured?
Yeah, so the way that I understood it from talking to people was that there's 3 90-minute preparatory sessions with drugs being administered. So, they go in and they would chat with a therapist or two, and there's about 6 patients in total, and I believe they chat with the therapist individually, so not in a group setting. And then these prep sessions were followed by an 8-hour session where the patients were administered MDMA in a relaxed setting. So, instead of a typical room, there would be a couch and some nice lighting, maybe some music. And the patients could talk and were monitored by the 2 therapists. So it was kind of very different. I think most therapy sessions, you walk in and you have an hour or 2 hours and you talk to someone, and this is much different. I think it was more of an observant 8 hours, but if the patients felt the need to talk or wanted to talk, they could. And then after that, from what I understood, the patients then stayed overnight at the clinic. And then that was followed by another 90-minute session, kind of a pre-breakdown without the MDMA the following morning to kind of talk about what they'd experienced and how they reacted to the drug and the therapy.
So now this therapy was trialed in Canada. So you were lucky to be able to speak with some of the researchers. Can you tell me kind of the impression that you got, how they felt about the outcome?
Yeah, absolutely. So it's also, I think actually the first trial was actually in the United States, down in South Carolina, I want to say, because MAPS, the whole trial is actually global wide, but the first one was in Vancouver, the Canadian one. And I think overall people were actually surprised, more so with the reaction. I know Mark Hayden, who is part of the study, he's chair on the MAPS Canada Board of Directors, and he's an adjunct professor at UBC School of Population and Public Health. He said he was very surprised by the military's reaction. He spoke to a lot of people who, I think a lot of people in the military, there comes to be a stigma with both PTSD and with drugs in general. So he was actually very surprised that there was this positive reception, that a lot of people were embracing the positive results. And to the study itself, I mean, there was a, I don't have the numbers right on me right now, but the results were very positive. The study isn't done yet. It's going into phase 3, I believe this June, or around that time, so they'll know more then. But there was a study in 2012 done that was very similar, and PTSD symptoms in patients were reduced by 56%. So the numbers that are coming out are very positive and very optimistic.
Yeah, it's very hopeful, and it really is the kind of the cutting edge. The Multidisciplinary Association for Psychedelic Studies is really opening up a whole new avenue for treating trauma, and it's very interesting because psychedelics in themselves have such a negative connotation in the history of their use, and it's only now that they're starting to be recognized for the potential of therapeutic benefit. And so we have a lot to thank to people who are really willing to push this forward at this time. With those kinds of results, you can see that there's the potential for really relieving a lot of suffering within a shorter window, using more intensive approaches, at least for a short period of time. Doesn't mean that people won't have to do ongoing therapy. I understand that, but it seems to alleviate a really kind of an edge of deep suffering, and that is quite a wonderful thing. Now, I understand that you've also just published another article that's related. Can you talk a little bit about your findings there?
Yeah, so the second article I published was a bit more detail about the study itself. I talked about the specific reaction to the brain MDMA has. It helps release neurotransmitters such as serotonin and dopamine, which is part of the process of helping people tap into their emotions and being able to talk more openly about what they've experienced. But I also did a bit of history behind MDMA and other drugs as well that have been used to treat sorts of trauma. That was really interesting because it seemed to be something that was very popular towards the end of the Second World War, and then the Drug Enforcement Agency kind of declared a lot of drugs Schedule 1, and that pretty much stopped a lot of clinical research, which is only starting to research now within the last 10 years or so. So I talked about that. I talked about some of the results of the other studies in the States, and I mentioned that phase 3 of the trial is going to happen, as I said, in June. It's important to note I also talked about Veteran Affairs Canada, and how they see the drug. And right now, they don't have, what's the best way to put this? They don't see it as a viable option for treatment yet, but I think what they're doing is they're waiting to see the outcome of the study and where it goes from there, and if Health Canada ends up approving it.
Wow, well, that's very exciting news. I'm really, really happy to hear that things are moving forward in this area because, I mean, if nothing else, in my work with trauma survivors, I see a lot of deep suffering, and if anything can really make a difference to move things forward and give people a sense of relief, that's a great thing. The one thing that really interests me about the MDMA is the connection with MDMA and oxytocin, which I think of as the hug hormone. It's the one where it's this emotional connection and gives you a warm feeling, kind of like mother bonding with child. And so I think a lot of what this work is pointing to is that when people feel that sense of warmth and connection, it allows them a greater sense of safety and security to open up that Pandora's box and start to really work through the difficult feelings that they've been experiencing. So I just want to ask you if you had any last comments about what you found about this whole research and MDMA, or anything that you think our listeners might be interested in.
Well, what you just said about the MDMA and the whole hug therapy or hug feeling you get when taking the drug. Actually, Dr. Alison Fiducia, the MAPS clinical trial leader, she had a great quote that she said to me. She basically said the MDMA seems to be like a tool or amplifier of the therapy, which I thought was a really great explanation of how it works. So, a lot of veterans, a lot of people who are in the military, they have a hard time sometimes discussing their emotions and their feelings in group settings or with people. So I really feel like the drug helps them overcome that. So I think, in terms of veterans, which is kind of the angle that I wrote it on, it also works for a lot of other types of people as well. It really, really helps them be more open and really touch into their emotions and and help them sort through the issues or the trauma that they've seen. As far as other remarks, I just encourage everyone to read the articles and look into the history of MDMA as well. It's very interesting. It was actually used by the United States Army in the 50s and 60s. They tested it on animals, and there was rumor the CIA even used it on in interrogation. So it's got a really interesting history as well, and I think now it's being used for really positive reasons. And I really hope that the third trial goes well and that we see more positive results.
Wow. Well, thank you so very much for your time, Tyler, and good luck with the ongoing work that you're doing in this area and the writing. Really glad that we had a chance to talk a little bit about what you're finding out, and I just want to wish everybody out there a gentle day.
For more Ask Dr. Anna videos and information about post-traumatic growth and recovery, subscribe and like our YouTube videos at What is PTSD, or join us at previous video episodes in our playlist Ask Dr. Anna from the Traumatology Institute team.